Okay, so we're live now. So we have a few participants now. So you can start the session.
Okay. Hello, okay. Hello, everyone, and welcome to today's session. This is the fifth part of a week-long series of Webodontia. These events are brought to you by the Rotaract Club of the Caduceus, an organization of youth medical and paramedical students. The Webodontia is a week-long event with educational webinars blended with fun activities. And before we begin, I'd like to mention that a recorded version of this webinar will be available on our YouTube channel, and the forum for questions will be opened at the end of the webinar. And the feedback form for availing certificates will be provided in the chat box on Cisco WebEx as well as YouTube Live. And with that being said, I'd like to introduce today's presenter. So today, Dr. Gopi has pursued his MDS in prosthodontics and DNB in prosthodontics. He is a diplomat International Congress of Oral Implantologists, a fellow Indian Society for Dental Research, a master and fellow International Congress of Oral Implantologists, and a fellow at Pierre Forchard Academy. Thereby introducing to you Dr. Gopi Chander. We are extremely fortunate to hear from you, sir, today. Looking forward to this enlightening session. Over to you, sir.
Thank you for the pleasant introductions. And the specialists happy to interact with the thing. The topic is going to be more apt for them, and this is going to be the future of dentistry as well. And today, augmented reality in dentistry. I think many of you are aware of what it is, maybe scientifically or in terms of literature aspects. Many may not know about it, but it is being used in daily lives in some way or other. But it's got extensive applications. So here my objective of this lecture is going to be in terms of enlightening you in terms of the technical aspects of the augmented reality or the artificial intelligence, make you aware of terminologies, but easy for you to distinguish what it is and how it is being used. Of course, in the clinical situations and in terms of the practical scenarios, it has been used in very wider platforms, and many of us are already using it. Maybe we are unaware at where it is being used. So with this, detail about this, I want you guys to be aware of the terminology so that it fits in terms of understanding concepts better. So what is artificial? It is a simulation of human intelligence. You make a machine think like you. So incorporate all the data, the machines, and mimic you or simulate you in the actions. So that is in terms of artificial intelligence. Machines that is used and the way it has been done has got many ways by which you have the options available. But in a more simpler way, you make a machine speak or think or do things like you. That is going to be called as artificial intelligence. There's numerous ways of classifying or grouping it, and that's more in terms of theoretical aspects. Make an understanding simple. It can be classified into three types: type 1, type 2, and type 3. One is going to be a narrow intelligence. That is basically in terms of the amount of intelligence that the machine can mimic. One is narrow intelligent. It has got a very minimal simulations. It can act or simulate you in a very minimal way. Basically, it's going to be a reactive machines with limited memories. Generalized intelligence, it's going to as good as you. That's going to be a AGI. And third one is going to be a supercomputers or super deep intelligence. It's going to have more supreme characteristics than you. Whatever the humans is going to have, it's going to have at least 10 or 15 times depending upon the programmings and the hardware or software that has been incorporated with the machines. So these are the three basic ways it has been classified in terms of artificial intelligence. To come back, these are the machines or programmed devices which is going to mimic a human in terms of the intelligence. It's going to think alike or do things alike the humans. Depending upon the capacity in which it's going to be simulating you or doing things, it can be grouped into three. That is narrow, general. General is as good as S. Super or deep intelligence is going to be combining 10 or 15 people of S to the device in terms of that. It can confuse you in terms of artificial intelligence. Basically, artificial intelligence can be grouped into virtual reality and augmented reality. So that is going to be my topic in terms of augmented reality. But there are also terminologies called virtual reality, which you are supposed to know about. And again, all these are going to be varied in terms of the hardware that is being used. Hope people understand the terminologies of hardwares and softwares and codings. There are also understanding required in terms of robots and bots. Robots are devices that can help you in terms of mimicking activities. Bots don't have the devices. It's more in terms of mechanical or physical devices are not going to be seen in bots. It's going to be more in terms of softwares. Whereas robots will have a physical simulation in terms of some kind of physical resemblance by which it can mimic your activities. The difference between the virtual and augmented reality is in terms of the platform in which it's going to simulate it. The augmented reality will have a real interactive experiences, like a simulated real environment, like what we see. In case we are going to simulate a college, you're going to exactly see the college in terms of all the architectures or infrastructure that is going to be present. And you can really interact with the environment over there. You might see some people moving around, you might see the patients. All that can be more of interactive and real-time simulation is going to be seen in the augmented reality. The main which distinguishes from the virtual reality is the real world simulations, whereas in the virtual reality you will have in terms of more of virtual simulation. How do you differentiate a virtual and real world? Most of your games, for example PUBG, you have a real kind of interactions, but the characters that is going to be more of a graphical simulations. It is not a real-time simulations. In case you want a real-time simulation, see the exact humans over there. So that's the difference between a virtual reality and augmented reality. The interaction is going to be many of the virtual reality games, many of the virtual reality platforms now give you a real-time interaction, but still there's going to be definitely lags between the communications and the simulations that's been seen. And the most important is the three simulations that is seen in the augmented reality. The newer virtual reality platforms might give you some 3D, but it cannot be as good as augmented reality. So the major differences between the virtual reality and augmented reality is this. One is the virtual world, make you understand this in terms of the games, which has got a simulated graphical representations of the objects. Whereas in augmented reality, will have a real-time world, exact what you see in the natures in terms of the parks or animals in the zoos, which has been simulated, which is commonly seen in our day-to-day lives. Both are simulative environments, but one has got a sensory perceptions to the virtual world, that is your augmented reality. You can interact with the activities that's been happening over there. So that's the major difference between the virtual reality and augmented reality. To make it more simpler, we are discussing in terms of artificial intelligence. Then we saw in terms of the classifications or grouping of your artificial intelligence in terms of the amount of simulation it can make. One is in terms of exact simulation, the other one got minimal, and the third one is going to be a super or advanced simulations. The other component which we want to get it classified in terms of the terminologies, that is artificial intelligence can be classified into virtual and augmented. Augmented reality is going to be exact simulation of your activities. Virtual is going to be more of a graphical simulations of the environment. And augmented reality has got interactive interfaces, whereas virtual reality will have lesser interactions and less of three-dimensional features. So this is a basic understanding about the terminologies. that is being used in terms of your augmented and virtual realities. You should also have an understanding about the evolution, because this is mandatory for you to understand the present generation artificial intelligence and augmented realities. More widely used in by Caudal and Missile in Boeing platforms in 1990s. Of course, it has a history of in terms of early close to World War II in terms of equipment used in British aircrafts, but features are different. What we see advanced platforms, maybe the younger generation as such is going to see a more advanced platform which has not seen the older platforms. But these were the major evolution breakpoints, that is in the Boeing and Sutherland in 1968 used a head-mounted display. All these are going to be important parts of the evolution of your augmented realities. Now it has got a diversified interest, especially in the medical and dental fields, because of many reasons in terms of improving the understandings of your cadavers, improving the understanding of how the human system works. Maybe as a dentist, we'll be more concerned in terms of the maxillofacial structures. Post 2000, there's a greater understanding of the augmented reality, and last 5-10 years, we have developed a lot in terms of augmented reality systems, in terms of dentistry. Terminology is used, it looks slightly complicated. Of course, the practical solutions are easy, but the term theoretical component is going to be slightly difficult. Many of us are using it, so I don't want to go in terms of the practical usages in terms of the augmented reality. I want to throw a light in terms of the technical aspects. That is, basically, it has got on hardware and software. Now, obviously, many of you know it in terms of the processors, displays, sensors, and input devices that is being used in terms of the generalized systems. If it's going to be a mobile phones, it's going to be the camera that is going to play a crucial role, and your MEMS sensor, that is micro electromechanical systems in terms of the accelerometer, GPS, and solid state components. So these are the major hardware devices that is going to be playing a crucial role in terms of creating augmented reality systems. One is in terms of the desktop and systems. Another one is going to be that used in your mobile systems or hand gear systems. Displays can be vary, something like your simple screen to the more complicated technologies. It can be in terms of the optical projections or the conventional monitors seen in your laptops and the desktops, or handheld devices, something like your mobile phones or tabs. Displays which can be worn by the human body, such as a head-mounted displays, which is commonly used in terms of playing your games, tennis, basketball. A lot of games have been available in the market which use the head-mounted devices. Eyeglasses, the commonest example is going to be a Google glasses, and you have an advanced versions of these eyeglasses in terms of eye tap systems and contact lenses. So all these are the display models that is going to be available in terms of the hardware that's going to differentiate in terms of your augmented reality systems. So hope initially we've been discussing about the terminologies to differentiate the complicated augmented realities. Next, we are talking in terms of the components of your augmented reality, especially the technical side, which is consist of hardware and software. We are discussing in terms of the hardwares. The hardwares are going to be in terms of the various processors, gadgets, accelerometers, GPS systems, and the projection screens, which can vary with various. And softwares are more customized. It's coded for individual needs. If at all you want in terms of your dentistry, they have according to the needs of the dental fields and specialties, we program these softwares. And the way the image registration is being used is again by computer visions or in terms of video tracking or visual odometry. All these are in terms of the technical aspects, and the algorithms, which is going to be especially used in terms of the type 2 and type 3 systems, which is going to act on behalf of a human, is in terms of the projective geometries, algebras, and all the exponential map systems, nonlinear optimizations, and the statistics that is going to play a crucial role in terms of the algorithms and that is going to be displayed or in terms of working activities of the systems. So these are the mathematical methods that play a role in terms of the various algorithms that is essential, and it's going to be programmed in the softwares. What we see is going to be the major concern. All these are the technical, whatever we is in terms of the technical aspects, but in terms of the user platforms, it's going to be classified in terms of whatever users do. We have a public, you can see, you can change things in the entire room, like it's been seen in the picture, where the whole body interacts to the software systems, all the algorithms that has been designed. This is majorly seen in terms of your the news reading rooms. So that is going to be the public interfaces. Next is in terms of the personal interface, which is used in your smartphones in a public space. You can handle things in terms of everything to your mobile phones. This is more private. That is your headgears, hand wearable devices. All these are going to be in terms of whatever wearable devices. That's going to be in terms of the third system. The last one is going to be intimate with the desktop systems, which may not be movable comparatively with when you see with other systems. So to go back, this is user interfaces. Initially, we have been classifying the artificial intelligence in terms of the memories and the simulation of the human mechanisms into three. Next, we divided into augmented and virtual reality. Then we went in detail about the divisions in terms of your the components of your augmented reality in terms of the hardwares and softwares. Now we are classifying the hardware systems, or sorry, the augmented reality systems in terms of the user interfaces. That is how it has been used in the public interface, personal interface, intimate interfaces. So because all these systems are used in different platforms, not just for dentistry, why diverse platforms are in our practical lives. The only issue is we are unable to differentiate this. So if at all you go in terms of technical aspects, this is a way you differentiate for the system that is being used. Next design is going to be your interactive designs. That is, you interact with your softwares. The simplest things in terms of the dress portfolios that you change, you look, you translate and check things. In terms of dentistry, you have your digital smile designs where you design your teeth and make the patient look into it to make them satisfied. Design of the patient, the size and shape of the teeth that can be changed. So these are interactive designs. The simpler example is in terms of your common social platforms, which comes with a lot of image modifiers. You upload your image, you draw some features, you enlarge your eyes, enlarge your nose, change your teeth. All these are common platforms seen in your common programs that is seen in your social platforms. These are interactive designs, which is going to be more interactive and involvement in terms of personalized way, especially in terms of the professional aspects. For us, we think in terms of changing the gingival curvatures, changing the morphology of the tooth, improving the visual cue of your presentations, or slightly advanced than the second versions. Initially, we had only an interactive one. Here, you modify to your more customizing to the patient needs. So those things becomes a visual design platforms. So applications of augmented reality, it is used across various disciplines. In terms of the major concerns, in terms of the visual art, tourisms, where they try to promote the tourisms, and widely used in your video games, and industrial designs in terms of education and healthcare planning and education, again, which is of major concerns for us. Obviously, all these have been used initially in the military and flight trainings and navigation systems. The latest one is in terms of our social platforms like Snapchat, which is part of this applications. But our major concern now is in terms of data. When you have so much of advantages, it also has got dangers, especially in terms of reality modifications. If at all majority of people try to move away from the country, we have some restrictions in the country in terms of street views in the Google Maps, whereas the street view options are available in terms of the international environment. You can directly get into the Google Maps and knock the doors of the houses, whereas it is limited for us because of the abuses and other issues. Abuses that can happen. So these are the dangers are also there in terms of the augmented reality system. why it is required in dentistry. Major concern here, because majority of us are working in analog models. We directly work on a tooth, we directly work on a patient. So we might think it is not required, but the concerns are great in near future. The simplified thought process in terms of the educations, especially the preclinical levels, where we'll make a lot of tooth preparations, make more cavity preparations on the tooth. Initially, it's difficult for us to make the students understand, or students will find it difficult in terms of understanding whatever the teachers say. So these teaching models can play a greater role in terms of making the students understand what. The second major concern is a more simplified way to appreciate this is in terms of your uh, anatomy, general anatomy learning. Most of us sit with cadavers. We'll see this nerve passes through this canal as this nerve vascular structures going in. So when they discuss, it's difficult for us to visualize. The obvious thing is next is we go to the atlas and look into all these aspects to learn. But the atlas and all these textbooks are two-dimensional, whereas these things are going to be three-dimensional, easy for you to really get into the bodies, and layer by layer you can understand the applications better, as well as in terms of the subjects, reading of the subjects in a better way. This application, especially in terms of the dentistry, all disciplines started using in terms of your augmented reality. It has an extended working time compared to the humans, more easy to use and precise to use, and complete the task at ease without human fatigue. Say, for example, I expect you to carve a tooth. It might take 15 to 20 minutes, or detail the anatomy of the tooth, extensive in terms of your clinical simulation that is seen in the patient mouth. A lot of time in terms of mimicking it. This is going to just copy, paste, and you're going to get it in a fraction of few minutes. So that's the advantage in terms of using your augmented reality. It's widely used in your digital radiographs, dental scans, and more extensively, practically size CAD CAM restorations, orthodontic aligners, oral surgery, in a lot of maxillo-facial surgery, surgical treatment plannings, and again, widely used in your implantology. Among this, CAD CAM restoration is very practically used, and in terms of your treatment planning for your surgical and implantology protocols, it's greatly helpful. Greater use has also been used in your dental radiograph interpretations and scan interpretations. Apart from this, you have a more diverse applications, which is going to be more practically applicable in near future. The most important understanding here in terms of your augmented reality or artificial intelligence is your computing. So what is this? Majority of us keep following the matches. You can see these statistics that have been displayed in your phones or in the Google's platforms. The minute someone bowls, they give you the prediction whether which country is going to win, X or Y, and in which stages it's going to display in terms of your status of your the result of the matches. So all this is happening in terms of the computing. They feed on all the data of the matches across that has happened over the years about the players. They give the inputs of all the databases that is required. They add all this information to the database about the players, about the situations, about the way the ball turns. So it's easy for the system to compute and give you the results, which is very impractical for a human to think about. This is the most advanced versions of the type 3 classifications of augmented realities. But of course, the calculations, which is done in terms of by many algorithms, which consumes a lot of time for a human to do it. But this is made very simple. You can get a ball-to-ball results, and this timely, whichever time you want, it can give you the predictions. And of majority of the situations, 95%, 99%, these results hold good. So that's about computing. The same computing works in terms of your dentistry as well as in terms of your medical systems. So it can predict diseases. It predict the success of your restorations. Once we give you the inputs of once the data is added to the databases, It can give you all the necessary information in terms of the prediction, in terms of the quality of the bone that's going to be available and how successful your restoration is going to be. Maybe it's not coming to the market still, but near future it's going to happen in terms of all this computing can play a greater role. So for now, it's used in terms of smart learnings in dentistry. Gives an interactive tutoring and helps in terms of diagnosis and treatment planning of various diseases, and of course widely used for various disciplines. Mostly it is used as a guide to make you understand the subjects, especially in terms of the preclinical levels. So preclinical training in education is a fundamental practical application in terms of your augmented reality in dentistry. It gives you simulated models, helps you to make your cavity preparations, make you understand where the canals are there, make you understand the depth of the dentine, make you understand the thickness of the enamel that is present, design your restorations, how successful it's going to be in terms of your evaluation procedures. All that is going to be combined with your preclinical training models. Both quantitative and qualitative training can be obtained with your virtual reality models. That's the major advantage of your augmented reality. Whereas in terms of the clinical systems or the conventional systems, it can only give you a quantitative measurement, qualitative measurements, whereas here it can give you a quantitative evaluation system that can help in terms of improving your skills. CAD CAM restorations, it's diverse. Majority of us are aware of it's being used. Single restorations is the most complex restorations. What you do is you prepare the tooth, scan the models, scan the tooth structures, transfer it to the system, design the restorations according to your needs, and mill it. Once the tooth is milled, you fix it up. So it can be in terms of the most simplified restorations to the most complex fixed partial density restorations or implant restorations that being obtained with your CAD CAM. The principle here is more in terms of combinations of various thoughts of your augmented reality. Basically, it's going to capture an image at various platforms or various interfaces. You take this captured images and stitch it to one model that is going to be the life-size model, what you make it in terms of the cast or die stone cast or dental stone cast. And it helps in terms of designing the restoration. So whatever the wax patterns you make, it's going to be, everything is done in terms of the designing. And instead of fabricating it, we just make it, the computer mill the restorations or print the restorations. So whatever the time and energy you spent in terms of fabricating your restorations in your labs has been greatly reduced in terms of the workload that has been involved. Second, the precision of the restoration is much superior compared to your human fabrication methods or human fabrication techniques. So this is the way it goes in terms of your designing. You can see the way the crowns have been designed. You add do the wax patterns, check for the occlusions, establish your finish lines or the margins of the restorations. Easy for you to do it in the sitting in a system and design your restorations rather than working on the burners and the lab in the laboratories. So once it is designed, you approve it. You go for milling it in the crowns. You select the type of material which you want. Various shades, various are available right from zirconia to your composite zirconia composite materials and ceramic materials. Once the restoration is milled, you fix it up in the patient. So it's very simplified procedures in terms of your the practical applications. But the process involved in coding and in terms of the hardwares and software designing is going to be complicated. So that's the reason why I was teaching you or explaining to you in terms of the initial part of the lecture in terms of the technical aspects of this augmented reality. The applications are very simple. You're just going to see certain things, design it, mill it, and fix it. But the concepts involved in terms of getting these things is slightly difficult to comprehend. So once you know these terminologies, you can differentiate things which has been used, and it's easy for you to understand. In terms of dental implants, so conventionally we make a radiograph, check in terms of your nerve, the path of the nerve, positioning the implants, all that is going to be very difficult in terms of the analog levels. Next came the 3D scans. CT scans which you used to help in terms of differentiating at various layers. Now you have very simplified options. You take the different sizes of implant, place it there, check in terms of both buccal and lingual positions, or in terms of the mesial and distal positions, check in terms of the amount of viability of the bone, whether it's going to interfere with the adjacent teeth or interfere with certain anatomical landmarks, locate and position it in terms of the angulations, design your restorations. It's made it very simple. Everything is going to be done in the systems. So process, which is going to be very complicated. The initial days, you open the flaps and check for in terms of anatomical structures in the analog way of doing implant, but time consuming, and there can be a lot of human errors. But here, everything is pre-planned. You know where the implant is positioned, what is going to be the size of the implant, how much distance is away from the adjacent tooth, where is going to be the critical landmarks present, what is going to be the restoration size and shape, how it's going to influence your occlusions. And to show that this is the way it's going to be done, this is the implant that's going to be placed, how it is going to look. This is being obtained with the augmented reality. Dental robots, again, it was when I was talking initially, it was differentiating in terms of robots and buds. Robots, you see some physical devices, whereas bots is more software, like Android platforms, or you only see a physical representations. So there are a lot of trials have been done in terms of fabricating your RPDs, CDs, and implant processes, which can be a more realistic future in near that's going to happen. So once that is done, I think majority of your preclinical exercises and the way the laboratory procedures have been done is going to have a different outlook. Only issue is you have to incorporate the data and code the robot, program the robot so that it's going to do a diversified applications whichever you want to do. Either it's going to be your fabrication of the dentures or making your restorations. Everything is going to be designed by the robots. These are the robots that is being used by different researchers. That CRS robots, Motorman, UPC6 robots. All these are used in dental platforms. It is useful in terms of your teeth arrangements, and at various stages of experiment it is in. Maybe near future it becomes a realistic applications. The moment it happens, I think majority of you guys, whatever the struggle that has been happening in your preclinical prosthetics are going to be avoided. Digital smile design is the most fantasized application that has been used in recent by the recent generation dentist. When I say there's some changes in the mesial angle of the tooth, this point angle has to be modified. A slight change in the color is required. A slight increase in the size of the tooth that is required, which is more of a prediction base. But these softwares will help in terms of exactly mimicking whatever you want to do. Can be shown. He approves it. You can, the system is such a way that you can now print it, mill it, and give it to the patients. Or fabricate the needs and fabricate a restoration at the immediately and give it to the patients. There are various softwares available. The commonly used is your DSD, that is Digital Smile Design, Cryo Smile Design, Smile Pro 8. So various application platforms are available. So only thing is you have to know understanding. You know the understanding of the applications to be used. It takes a little bit of time for you to get used to that systems. The younger generations can easily adapt to this software of the older generations. So it's just an applications, but of course you have to have a basic knowledge of what it is, what a smile is, what is terms of restorations, how best you can modify their tooth structures and everything. So once you have the basic knowledge, which is going to be incorporated in which is going to be taught in your dental schools, apply this knowledge in terms of whatever the software applications are given. Explain to the patients, and you will also know what exactly the restoration is going to look like, and you can give the best of restorations and the best of smiles to the patients. Of course, what we have now is the advanced versions, but more evolution is required in terms of all these smile design platforms, applications. A more three-dimensional conception is necessary to make a better designing of the restorations. Now you have a video analysis, but you need a lot of functional movement evaluations that can help in terms of your designing and fabricating your restorations. Not going in detail about this software, the concept here is you capture images at various positions, right from your frontal view to the profile views. Take everything to the software, it can stitch into a three-dimensional images. Most important concern for us is it's not the two-dimensional. So you modify and or reduce the size of the tooth in with the various tools that's available in your softwares, and you check it. Since the entire patient image is going to be seen, you can conventionally alter the size of the tooth or increase the width of the tooth or modify the position of the tooth or the gingival levels and see the presentation that is available. Certain things are realistic possibilities. Many things are not, because at the end of the day, you're going to apply things into the clinical environment. Many things may not be practically possible. But with the technology advancements, this also going to be practically possible because it's going to be connected directly to the milling machines or the printing units, which can mill the restorations and give it to the patients. So that's the advantage of your latest smile design platforms. And the major advantage is here is you can present it to the patient, show the patient before you start the treatment. You can show the reflections that's going to predict the treatment to the patients, convince the patient for the treatments. There's a significant advantage of all these software applications. The major change in terms of fabricating a maxillofacial process is being with your digital platforms. The conventional way is to make impressions of the facial, in terms of facial moulage. You consume a lot of material, a lot of technical help, support required, and skill is required in making the impressions. Now, made very simple. You capture images with your mobile phones. Forget about the higher grade tech. You capture images with the mobile photogrammetry technique is being used. They give you a definite designated position, say at 0 degree, 45, 90, 135, 180, and the position in which you capture the image in terms of the position of your face and the camera. Transfer this to the applications. It can stitch the dimensional model as shown in the picture. Once this is obtained, you know, and easy for you to mill the patient face with the defect, or you want to design the restoration, you can design the restorations in the digital platforms. Been done, this is not my case, it has been adapted from a journal. The way it has been used, you can see the various images that have been made, a three-dimensional model has been stitched. You can see the defect. They have to mill the patient face here. All these are not out of reach to us. It is also India. We have a lot of government of India supported projects in the Make in India, Make in India concepts. A lot of prosthodontists are working on this in terms of getting things in terms of more defined platform, in more customized Indian platforms. It's totally not out of our hands. You give a CT scan to the people, they design the restorations and make a restorations and give in terms of give you a maxillofacial process. So that's the advancements we have now in terms of fabricating your maxillofacial process, which is basically obtained with your augmented reality. A lot of your maxillofacial surgeries require a lot of treatment plannings, designing your the amount of bone reduction, predict the outcomes. It was slightly difficult in the conventional case. Now it's easy for you with the various software that is available. You can think in terms of all the virtual plannings can be done in the screens, and you can really predict the outcome of your surgical procedures. So that's the advantage in terms of your digital systems, in terms of the guided maxillofacial surgeries, especially in terms of correcting your jaws. That's for cosmetics. You can really predict the outcomes, give it to the patient, project it, obtain the consensus, and your precision also is going to be accurate in terms of your surgical skills. Obviously, non-orthodontics is going to consume a lot of time. You know that brackets are going to be fixed in mouth. We have various modifications to the brackets, right from your metal, it's evolved to ceramics, making more the tooth appearing. But the changes are more drastic with your digital platform. Now they make your impression. They use something called as aligners, more popularly used in terms of Invisalign aligners across the world. They make some impressions of the patient mouth, plan the treatment, predict the movement of the teeth in terms of your treatment plannings, give you in terms of a clear, what to say, a cap splint like a kind of a soft splint has been given, which is not going to be very visible in the patient mouth. Something like a soft cushion that is going to act. It helps in terms of moving the tooth and get the teeth into the proper alignments. So that's the advantage we have with the digital platform in the orthodontics. This is slightly expensive in the initial stages now, but there are a lot of hobby printers and a lot of people working in terms of in a more passionate way. I think all this costing will come down. It will become very affordable to the patients. The supercomputer systems or the type 3 systems of augmented reality or artificial future that is which we are going to face on, or which is going to be really important for us. Input the data to the system can help in terms of the diagnosis, especially in terms of the caries, identify the periodontal diseases. It also plays a role in terms of predicting the diseases for the patient in terms of the certain characteristics that is going to be uploaded to the system. Most important is prediction of the cancer in terms of oral cancer, which is going to be the most fatal component of our community. So it can easily predict in terms of whatever data you give or whatever the diagnostic measures that's going to be transferred to the systems. So all these are going to be realistic future. Many of this are been already available, but with more accuracies, it can detect and predict and helps in terms of resolving a lot of diseases. That's the major advantage of your super computers and in terms of the digital platforms that's going to be available in the near future. This phase we have been discussing about the advantages. There are also limitations in augmented reality in dentistry. One is the cost. It is very expensive because of the gadgets that's used and the codings and the technical aspects that has been involved in terms of getting these devices run. But again, if it's going to be just a cost, we always have an economic alternatives for this. And with the market expanding, there are going to be greater consumers. It's going to become as cheap as possible. Second is in terms of the understandings. Many of us may not understand the way. So it's required in terms of the technical aspect. You have to be a little bit knowledgeable in terms of to make the systems more applicable to the practical realities. And with more research that has been happening across, a lot of developments of the devices that has been happening, and the applications will also improve towards dentistry. A few studies that has been done, especially the models, and in terms of systems, we need more established designs. The most widely accepted is your CAD CAM systems in terms of milling your restorations. But again, there are a lot of variations to that aspect. So we need extensive studies in terms of long-term studies that is going to be helpful in terms of predicting the advantages of your augmented reality. As discussed here, it's very effective in terms as a learning tool at the preclinical level. Education, encouraging results of CAD CAM restorations, aesthetic dentistry, maxillo-facial surgeries, and implantology. A lot more studies are required in terms of making it more precise to the dental applications. To develop a lot of interest in AR, initially closed platforms. Now we have a lot of open source platforms, which helps in terms of improving our applications, and everyone can start working on it. So it becomes more easily available to the common persons. It reduces the costing. So only the limitation is the application of your augmented realities, which gets improved with in terms of the understanding of your science behind your augmented realities. The present scenario, it is widely used in terms of your maxillo-facial surgeries, in terms of planning the treatments and presenting to the patients. Next is in terms of the 18% that's been used in terms of cavity restorations. Next is in terms of the education systems as an educational model. Of course, it's used in other aspects like your endodontics, implantology. major components used in your CAD CAM restorations. It has got a greater prospects in terms of the clinical procedures in near futures. The most important aspect of this is to make you understand the concepts, get used to these concepts and techniques and utilize it. CAD is simple. You should know the terminologies in terms of your artificial intelligence, virtual reality, augmented reality, the various hardwares and software that is being used, the advantages and limitations of the systems, the applications of augmented reality in dentistry, because majority of this has been used in even day-to-day lives. But the complex in this, the understanding to differentiate in terms of which is artificial intelligence, which is virtual reality. Maybe we think in terms of more in terms of applications or apps that is being used. But it has got a diversified use. You have to differentiate its use and apply it in dentistry. Program, especially the organizing team, a great number of people, and the delegates who are listening to me. A lot of images that happen to use it from different sources, web platforms, to acknowledge all the platforms from which I happen to adapt the images. Thank you.
Thank you, sir. Thank you. I'd like to thank you on behalf of our club for taking some time out on this busy Monday evening. And and the best take-home message is that most of us didn't know that technology could make an entire profession easier to deal with, and it is astonishing. Thank you, sir. Thank you so much.
Thank you. Any queries from the people, questions which I'm supposed to answer?
No, sir, I don't see any question.
Fine. In case you need something from my side, you can text me. I can get back to you.
Yes, sir. I request the audience to fill the feedback form in the chat box. So there is a question. Hello?
Please.
Yes, sir. So for using augmented reality technologies in the present dental scenario, how are you using the coding methods for the same?
Technically, the coding methods, I am unsure about it because I am not a technical person in it. But the simplest example is in terms of your CAD CAMs that is being used. For example, you design your restorations, then you shift it to the milling or printing unit. When you print or mill, you have different restorative materials that is being used, right from zirconia, ceramic, and modifications of various composites that is being used. So there's a coding involved in it because the way it mills is different. If it's going to be ceramic or zirconia requires a hard milling. Ceramic requires slightly softer, and acrylic requires slightly more softer millings. So the coding has been done by the technical people in terms of our material of choice. The same thing applies for all the aspects. So coding is more a technical side. Maybe if someone is who has a technical knowledge in both is dentistry as well as in terms of the coding systems, it can play a greater role in terms of your job opportunities. One, second is in terms of improving the applications in dentistry. Hope I gave you the answer.
Yes, sir. He said thank you.
Any more questions?
No, sir, I don't see any questions.
Can I sign out then?
Yes, sir.
Thank you. Thanks for the opportunity.
Thank you, sir.